Introduction. Welcome, medical students, to today's lecture on Becker myopathy. In this comprehensive script, we will delve into the various aspects of this muscular dystrophy, exploring its molecular mechanisms, clinical presentation, management approaches, and much more. Becker myopathy is a genetic disorder characterized by a deficiency of dystrophin protein, leading to progressive muscle weakness. Throughout this script, we will address the intricacies of this condition and provide you with a solid foundation of knowledge. So, let's begin our journey into the world of Becker myopathy. Becker myopathy, previously known as Becker muscular dystrophy, BMD, is an X-linked recessive disorder primarily affecting males. It is caused by mutations in the DMD, dystrophin, gene located on the X chromosome. Unlike Duchenne muscular dystrophy, DMD, which is usually more severe, BMD presents with a milder form of muscle weakness and has a later onset, typically in the second or third decade of life. Dystrophin, a large protein encoded by the DMD gene, plays a crucial role in maintaining the structural integrity of muscle fibers. In Becker myopathy, mutations in the DMD gene result in reduced or altered dystrophin production. The absence or dysfunction of dystrophin disrupts the dystrophin-associated glycoprotein complex, DGC, leading to increased muscle cell fragility, impaired cellular signaling, and subsequent muscle degeneration. The clinical presentation of Becker myopathy varies widely, even within affected family members. Common symptoms include progressive muscle weakness, predominantly affecting the pelvic girdle, thigh muscles, and calves. Patients may experience difficulty with activities such as walking, climbing stairs, or rising from a seated position. Diagnostic evaluation involves a combination of clinical examination, genetic testing, muscle biopsy, and electromyography, EMG. Differential diagnosis should encompass other neuromuscular disorders with similar phenotypes, such as limb-girdle muscular dystrophy and myotonic dystrophy. Management of Becker myopathy primarily focuses on symptomatic and supportive treatment strategies. Physical therapy, occupational therapy, and orthopedic interventions aim to improve muscle strength, mobility, and overall quality of life. The regular monitoring of cardiac and respiratory functions is crucial to identify and manage associated complications. Genetic counseling and psychosocial support for patients and their families play an integral role in addressing the emotional and genetic aspects of this condition. Cardiac involvement in Becker myopathy is a significant concern as the disease progresses. Dystrophin is expressed in cardiac muscle, and its deficiency can lead to cardiomyopathy and heart failure. Patients require regular cardiac evaluations, including echocardiography and electrocardiography, to monitor cardiac function and initiate appropriate interventions when necessary. Medications, such as ACE inhibitors and beta blockers, may be prescribed to manage cardiac complications. Respiratory complications can arise in individuals with Becker myopathy due to weakness in the respiratory muscles, including the diaphragm. Regular monitoring of pulmonary functions through spirometry and assessing for symptoms like shortness of breath, nocturnal hypoventilation, or respiratory infections is crucial. Non-invasive positive pressure ventilation, NIPV, and assisted cough techniques may be utilized to improve respiratory function and prevent respiratory failure. Becker myopathy is an X-linked condition, which has implications for reproductive considerations and genetic counseling. Female carriers have a 50% chance of passing the affected X chromosome to their offspring, while male offspring have a 50% chance of being affected. Genetic counseling is essential to inform carriers about the risk of having affected children and to discuss family planning options, such as pre-implantation genetic testing or prenatal diagnosis. Research on Becker myopathy has relied on the development and study of animal models to further our understanding of the disease and explore potential treatments. Animal models, such as the dystrophin-deficient MDX mouse, have helped elucidate the pathological processes underlying Becker myopathy and evaluate therapeutic interventions. These models continue to be valuable tools in the search for effective treatments. Histological analysis of skeletal muscle biopsies in individuals with Becker myopathy reveals characteristic features, including muscle fiber necrosis, regeneration, and fibrosis. Electron microscopy further elucidates ultrastructural changes, such as the disorganization of sarcomeres, abnormal mitochondria, and accumulation of fat droplets. These observations aid in the diagnosis and monitoring of disease progression. The dystrophin-associated glycoprotein complex, DGC, is a crucial molecular assembly located at the sarcolemma of muscle fibers. It functions as a mechanical link between the cytoskeleton and the extracellular matrix, providing stability to muscle cells during contraction. In Becker myopathy, the disruption of the DGC contributes to muscle fiber fragility and susceptibility to damage. Advancements in genetic testing have significantly improved the diagnosis of Becker myopathy. Next-generation sequencing techniques, including whole exome sequencing, allow for the identification of DMD gene mutations, facilitating early and accurate diagnosis. Additionally, the development of antibodies targeting specific regions of dystrophin protein aids in the evaluation of dystrophin expression levels and distribution within muscle tissue. Physical activity and exercise play crucial roles in the management of Becker myopathy. Tailoring exercise regimens to individual needs and capabilities is essential to improve muscle strength and prevent deconditioning. Strength training, low-impact aerobic exercises, and stretching exercises are commonly recommended, along with appropriate monitoring and guidance from healthcare professionals. In conclusion, Becker myopathy presents us with a complex array of molecular, clinical, and management considerations. Through this detailed script, we have explored the intricacies of this genetic disorder, ranging from its pathophysiology to its impact on various organ systems. Remember, further advancements in medical research and genetic therapies hold promise for improving the quality of life for individuals living with Becker myopathy. As future healthcare professionals, it is crucial to stay updated with the latest developments in the field and provide optimal care to these patients.